My presentations today are about perioral rejuvenation as well as understanding potential neuromodulator complications. In terms of perioral rejuvenation, we see lots of patients who come into our practice and they want to do something about this area here, albeit etched in lines, adding volume to the lip, softening the nasolabial fold or oral commissure area, or treating with a neuromodulator some of the pebbled chin appearance. And I think it's important for patients to realize that there's a spectrum of treatments that we can do. These treatments may be very complementary, and we can do these in terms of using a laser for etched in lines. That may be a fractional ablative device over a series of treatments, or it could be a fully ablative device, and some of us have actually gone back to using fully ablative technologies such as erbium to resurface the area in less treatments. In terms of lip augmentation, we need to be very careful to preserve the normal architecture and anatomy of a patient and not go up to different significant volume steps, but really just add specific volume into focal areas such as the little tubercles and add volume to these areas to make patients really look natural. Soften the nasolabial fold but not make it flat, add volume to the oral commissure. Consider a neuromodulator in the area of the depressor anguli oris to be potentially synergistic with the filler that we placed more medially, and then soften the pebbled chin appearance using a neuromodulator as well. We also use all therapy for the treatment of the neckline and to hopefully lift the neckline as well as the submentum. And then in many cases, we're actually doing combination therapies in the lower face region. I may take a patient who has significant lines in the upper lip and a lot of musculature in that area and use a neuromodulator first, and then bring the patient back about a week later and then resurface the area. And then there's less mechanical action imprinting into those lines, and there's actually been a dermatologic surgical paper by Kadunk in 2007 to suggest that that's actually more helpful when we do ablative procedures by mobilizing the area with a neuromodulator prior to that.